Hi, I'm Emma. I'm a second year medical student. Can I just check your name and date of birth, please?
Yeah, I'm Erica, Erica Smith, and my date of birth is the 4th of April 1982.
Okay, well it's really nice to meet you, Erica. Can I just ask who you brought with you today?
Yeah, this is my twin sister, Anne.
Oh, nice to meet you. Nice to meet you too. Okay, so I'm just going to ask you a few questions. Is that all right?
Yeah.
Great, fantastic. So, what can I do for you today?
So Anna booked the appointment for me. I've got a mole on my face.
Okay. No, let me stop right there. Okay. So the real reason why I brought Anna here, Erica here today, is because she needs a smear.
Oh my god. Not this
Okay.
again. I'm really sorry about this.
No, don't be sorry. So, have you had a smear test before?
I have had one before, yes. Sorry, I can't believe you've done this. You booked an appointment and told me it was about something completely different. Is she even allowed to do this?
Well, I'll do whatever I want to.
Okay.
Okay,
course you
so
are.
what are you particularly concerned about given that you've booked this appointment for your sister?
Well, our mum, and there's a family history of cancer. Our mum
Right.
died, and our aunt also has cervical cancer.
I'm really sorry to hear that.
Like, we need.
Well, our mum had breast cancer, not cervical
Well, it's
cancer.
cancer, nonetheless, right?
Okay, yeah, they can be linked. So, you said you've had a smear test before. Can I just ask you, how did that go?
Well, since you're asking, it didn't go very well, actually.
Oh, really? I'm really sorry to hear that.
Yeah.
Could you tell me a bit more about that?
It was only a few months ago.
Right, okay.
And to be honest, it was a really painful experience. And sorry.
It's okay, take your time.
Why are you crying?
Can you just?
Like, honestly, it's no big deal.
It sounds like
Maybe not to you, but you need to be more
It's
understanding.
such a crybaby.
Okay. So, Erica, if you're feeling alright, would you tell me a little bit more
Yes,
about what
yes.
happened?
Sorry.
It's okay.
So it was really painful, but I just felt so undignified.
Yeah.
It was with it was like a male nurse that did it on me, and well, I don't know, I didn't think that would be a problem, but I guess I didn't realise it. I just really felt uncomfortable, so the whole situation was just kind of it just made me never want to be in that position again.
Yeah, it's not a comfortable experience, but the screening program as a whole is really, really important. Do you know why you screen for cervical cancer?
No.
Okay, well, cervical cancer, it used to be a really big killer. And what the smear test does is it picks up some cells from the cervix, which then goes off to a lab, and they check to see, first of all, if there's any signs of cancer, but also if there's any signs of what are called precancerous cells, which are cells that are okay but could go on to develop cancer. Now, if we pick those up, it means we can then treat the cancer early before it causes any problems, rather than leaving it until later when it can do a lot more damage. So does that sort of make sense?
Yeah, that makes sense.
Yeah.
Can you see why it's so important?
Yeah, I get why it's important, but
Then why?
I just said that. Are you not listening to what I'm saying?
You're being silly.
It's like talking to a bloody brick wall sometimes.
Excuse me, mate.
It's not a comfortable experience, but it is really important. And you said that sort of having a male nurse do the smear test was quite uncomfortable. There's things we can put in place to try to make it a more comfortable experience for you. So we can make sure you've got a female nurse. We can book you in for an appointment that will give you a bit more time to get in and get comfortable. Does that sound better?
Yeah, that sounds better, but yeah, I could think about that.
Yeah. Well, thinking about it is a good place to start. Is there anything else you want to ask me? Anything else that we could do for you?
No, I don't think so.
So you're going to do the smear then?
I'll think about it.
You will do the smear.
I'll think about it.
Well, we can book you in today if you're feeling comfortable. Can I just check, how long ago did you have your previous smear?
Oh god. Literally a few months ago. I can't tell you how many exactly.
Right, okay.
Yeah.
Because normally the gap between the smear tests is it's 5 years, and you come in slightly more regularly if they spot any signs that look a bit unusual.
So
So we could book you in if you're particularly concerned, but usually we leave it a little bit longer.
I got a letter for it to invite me.
Oh, you did get a letter for it to invite you? Okay.
Which you've obviously seen and gotten. Okay.
Yeah.
Right, okay.
I've seen it.
In that case, my mistake. If you've had the letter, then we can definitely book you in.
Okay.
Okay. So, would you like to do that today?
No.
Alright, okay.
I'm going to think about it, I will, because
Alright.
I understand what you're saying.
Okay.
So I'll think about it.
Okay.
I will do.
Yeah. While you're here today and while we're sort of all start talking, is there anything else that you want to ask me about, like the whole process, about science, that would make you feel more comfortable with it?
I guess there's no way to make it less painful, is there?
No, but usually it shouldn't be painful. It's usually quite uncomfortable. The sort of more comfortable you are, the more relaxed you are.
Right.
The less unpleasant it is.
So you think maybe like if I have more time,
yeah,
time to relax, that might be better.
Time to relax. And if we get a female nursing, as you said, that'll make the whole experience a bit more comfortable for you. Is there anything else to worry about?
If I change my mind, like while it's happening, can it stop?
Yeah, you can say no. At the end of the day, it's your body, and while I would strongly recommend that you get this test done, and your sister clearly would also strongly recommend that you get this test done. At the end of the day, it's your body and it's your decision.
You have 1 minute left.
Got 1 minute left. Okay, so you said you're going to sort of have a think about it. Again, I would recommend it because if anything does come up, there's always a concern that something might. If you've had the test, then we can sort of treat it earlier. But there's also a very, very strong chance that it will come back completely clear, and then you've got the peace of mind of not having to worry, this might happen, which will help. So, to sort of summarise, we came in from a mole and it turns out it wasn't a mole, it was a sort of query about a smear test. We've had a discussion about that. I hear that you've had a bad experience and we would not want to repeat that. But we talked through sort of various ways that will make you more comfortable, so giving you more time, having a female nurse there. Is there anything else that I can help you with?
No, that's everything. Thank you. I'm sorry about this.
No, don't need to apologise. That's what we're here for. Alright, so are you ready to book it in? Yeah.
Thank you.
You can either book it by phone, book it online, but
Alright.
we're here when you're ready.
Thank you so much.
Anything else I can help you with?
No, thank you. I've
Great.
got what I came here for.
Okay. Well, thanks very much for coming in. It's nice to meet you both.
Nice to
You
meet
too.
Thank you. That's the end.
So we will now give you back your feedback in 2 minutes. So you introduced yourself, you established the patient and who they brought in with them. Your conflict resolution was really good. You let them talk it out and then intervene once you had the information and once you felt it was appropriate. Your manner was really good, the way that you held yourself and you seemed very confident in what you were saying. You were very polite to both of them, made both of them feel really heard, listened to them, addressed any issues that they were having, really got down to what was the root of the problem with why the patient didn't want to have a smear, and you really accommodated what she wanted in order to feel safe to do this. I think it was really, overall, really well done.
Yeah, I agree. So you started off well with a good opening to the consultation. You explained what the smear was clearly and simple jargon. You allowed the patient to speak throughout, giving them time to pause. And you summarised well at the end.
Thank you very much. Do you guys have some feedback as well?
Yeah, I would agree. I felt very listened to, and I felt that I was prioritising, not my companion. And I felt that you were very comforting, reassuring, and you weren't too pushy or judgmental in any way. So yeah, that was really good.
Yeah, I agree. I felt like really comfortable throughout the consultation, and I felt that you dealt with my hostility in quite a calm way, and you didn't interrupt or anything like that, and I felt like obviously I got what I wanted, so you dealt with the situation very well. So
Thank you very much.
I just wanted to add, I think you did forget to offer her solo consultation if she wasn't fully comfortable with her sister reading the room. That should be